A more immediate impact will be felt by those tasked with picking up the slack. While this is a statewide situation, we heard this afternoon from eastern Idaho and south central Idaho hospitals as well. The CEO of Minidoka Memorial Hospital in Rupert telling us helicopters landing at his hospital to bring in patients, it doesn't happen, like ever. It's usually the other way around. But because of COVID, that's exactly what is happening, leading them to turn their surgical area into a COVID treatment area. And they only have one ICU bed there. Portneuf Medical Center in Pocatello, right now in contingency care, but if the current trend continues, they could be in crisis care mode as well, soon. But this crisis mode doesn't just affect the hospitals who request it. It has a ripple effect. If a hospital is in crisis care standards, you would think someone who is sick might have a better chance of being seen sooner, maybe at a primary care clinic instead of a hospital emergency room. Well, don't bet on that either. In fact, that's already a difficult assumption to make. Primary Health has clinics across the Treasure Valley, 600 employees, 99% of them vaccinated or with an exemption. And they still have 30 to 40 people out sick because of COVID each day. Either they have it or a family member does. CEO Dr. David the CEO, I should say, of Primary Health, Dr. David Peterman, he tells us their resources are already pushed to the brink and have been for a while. And with this declaration today, he only expects them to get worse.
And we're already gearing up as of today to be ready to take patients that need early discharge from the hospital. They'll be sicker and they'll need their family doctors and their internists to take care of them. And so we're prepared to do our part.
When you say early discharge, explain what that means.
Well, typically we all understand when we have a surgery, or for that matter, for example, we say we have pneumonia, or in this case, if I have COVID, sometimes we would say, well, let's keep you an extra day, make sure you're doing okay. You can't do that now. This is what happens with crisis of standards of care. You have to prioritize, and it's incredibly disheartening, very disheartening.
So the big domino has fallen with the major hospitals under this crisis standards. How does that affect a primary health facility?
Yes, so at primary health, it means the demand is going to continue to go up for our services. Second, they may be sicker and likely are sicker, and we have to be prepared for that. And the third part of this, our family doctors have to be ready for those many patients who might normally stay in the hospital another 2 days, another 3 days. They have to be prepared that they'll be discharged, and we have to monitor their care in the outpatient.
I know when we were this close, when we were close the first time to crisis standards back in December.
Yes.
It was said that if we reached crisis standards of care, we failed. Is that still the mentality?
Well, as a physician and part of a medical group that sees thousands and thousands of patients, if we can't see the patients, yes, that's a failure. We pride ourselves in being accessible. That's the whole point of primary care, that you can call us, you can text us, you can email us. We can see you in our clinics. You don't need an appointment. Today, when you go from 40,000 phone calls a month to 80,000, we can't answer every phone call. And we're having to close our clinics early. We are closing our clinics early at 7, simply because it takes the staff and the doctors from 7 to 11 to catch up so that they'll be ready for tomorrow. It's not like me to say I can't see you. As a pediatrician my whole life, someone comes to me, oh, so-and-so's here, can you see him? Yes. I have to see them. That's what I do. And we are daily turning people away. And it saddens me. I took an oath. Do no harm. Take care of the patient. I'm closing the doors open, and I cannot guarantee you we can answer the phone. It's upsetting.
Dr. Peterman made a huge exception to speak with us today. Today is Yom Kippur, the holiest day of the year for the Jewish faith. He's supposed to be in services, not at work, but Dr. Peterman believed he has a moral obligation to get this message out. And he explained it to us this way. Yom Kippur is a day of atonement, a day when you're supposed to think about how to be better, how to atone for the sins committed over the past year. Fundamental to all of this, he said, is how we can be better to our family, to our neighbor, to those we don't even know. He said it saddens him that too many in our community, those that are eligible, have yet to get vaccinated or even wear masks indoors or in crowds. He's frustrated that many of us can't think beyond ourselves. He said, as you heard him say, he took an oath to do no harm, to take care of patients. And right now, yeah, he is saddened that he can't even guarantee that he can answer the phone.